Breaking news just in about Joan Rivers going into what sounds like sudden cardiac arrest secondary to a procedure that was being done on her throat. Stay tuned for more on this coming up next. That Joan Rivers, a longtime comedian, well known in the public, it reportedly has gone into sudden cardiac arrest this morning. It's a little bit rough to know exactly what her status is now, but it sounds like she may actually be in critical condition, trying to recover from this episode at Mount Sinai Hospital in New York. The reason I wanted to talk about this is not just to repeat news, but that some of you maybe are scheduled for endoscopic types of procedures or throat procedures, and you're a little bit concerned about what may have taken place here that caused her to go into cardiac arrest. So I wanted to just take a couple minutes here and maybe shed some light on some of the different things that may or may not happen whenever we have a surgery or a procedure performed, and maybe relieve some of those misconceptions and fears that you might be facing, but also make you aware of some of the things that actually might be a threat that you need to consider. So, first things that came to my mind in regards to why a person may go into sudden cardiac arrest for having a procedure done, like throat surgery, is there's always the potential for an adverse reaction to the anesthetic. So if the person is actually going under a general anesthesia, which means they're actually put under with chemical, pharmaceutical grade medication that puts them into an unconscious or semi-unconscious state or a paralyzed state, there's always the potential risk for a complication, either due to a drop of blood pressure, a reaction to the medication, an allergy to the medication, or something like that. So there's definitely that threat. Secondly is that, they're in the area of the throat, and in the area of the throat there are these vagus nerves that if they're stimulated too much, or if they're stimulated at all, and there may not have been any way not to do that, it could potentially cause a bradycardia, a slowing down of the heart rate, that could also lead to a drop of blood pressure and then lead into cardiac arrest as well. Thirdly, she could have had an underlying problem. She's 81 years old. There's been some reports that admittedly she does not really work on her diet tremendously. Now she may be just being funny. She is a comedian. She's 81 years old. So cardiovascular wise, if she had some chronic long-term vascular problems, she could have thrown a blood clot. She could have had a heart attack just due to the stress of the procedure. It's hard to say what could have happened, but the best thing that you can do is communicate well with your physician. Make sure that they understand your concerns in regards to going in for surgery. Make sure they explain to you what the potential side effects could be to having a procedure like this performed. And then thirdly, and it's like I tell everybody, have everything prepared. I think sometimes we take procedures for granted. It's not in a hospital, it's at an outpatient, and suddenly we don't think it's an important procedure, but you just never know what could happen. And so talking to your family, making sure that you have kissed them all goodbye and that your paperwork's in order, and that you're at peace with the prospect of dying is always an important thing every day. We just don't have any guarantees in this life, but especially in cases where we're going in for surgery and there could be complications. So our thoughts and prayers go out to Mrs. Rivers and her family during this time. We hope that she recovers well. She's brought a lot of laughs to the world, and it's never easy for anybody to go through this. So stay tuned on the outcome, but it's breaking news right now, so some of you may have some questions about how it could have happened. I hope this sheds some light on it. Until next time, keep on rescuing, and we'll see you soon. Bye-bye.